How to inject testosterone by yourself. In this video, testosterone replacement therapy expert Danny Bossa explains and demonstrates TRT start to finish.
Please like and subscribe. Thank you.
And hit that notification bell so you won't miss anything. For someone who begins to self-inject testosterone and is afraid about doing this, how often to inject a week, intramuscular or SubQ, and what injection sites? Go ahead, Danny.
Okay, so I started off with the androgel route, which you guys want to avoid like a plague. It just does not have enough to boost your levels to where they need to be. So just forget about using androgel. Forget about using pellets. When I tried cream, I had put it all over my shoulders and stuff. I had no idea about that whole transscrotal approach that Dr. Nichols is doing. And that didn't work very well either. And at that point, I said, let me get to the injections. So if you're terrified of injections, you can do the transscrotal cream. You can apply it once or twice a day, ideally twice a day on your scrotum. You basically just shaving a little area, keeping it clean, keeping it dry. You just put a little bit on and morning and night, and that's it. If you want to do that route, contact Dr. Nichols. He can get you pointed in the right direction for that. A lot of the guys in the group are getting their levels way higher than they were getting with whatever injection stuff that their doctors were prescribing. So that's one thing you can do if you're scared of needles. If you don't have a doctor in your area that does that type of thing and you're really only stuck with injections, then you got to do what I started doing. So I was the biggest pussy when it came to injections, okay? The sight of a needle, just pulling out something like this and looking at it would make me faint. I'm not making this up. You can ask my wife. Just looking at a needle, I would get dizzy and I'd pass out, okay? So I knew I had to do injections at one point because, again, I didn't know about the cream. And me being the researcher that I am, I wanted to research what is the least painful site to inject, what type of needle, all this type of stuff. So the first thing you got to keep in mind is the sizes of the needles, okay? So I'm going to just show you a couple different sizes of needles. I'm going to grab, so I have a case. I get these by the case, okay? Because I'm basically injecting myself every day, all right? So this is I don't know if you can read this. It says BD syringe, BD 1 ml, TB syringe. It comes with a 25 gauge needle. What you need to know about needles is that the higher the number, the smaller the needle. Okay, so I'm going to show you. So this is what's called a syringe. If you hear a plunger, well, this is the plunger. The needle is here, and on this, it comes off. Okay, so I can put different size needles on top of this syringe and just use the one syringe. So if I look at this needle here, which is a 25 gauge, and it's a 1/2 inch. So here's, I'm going to hold that up next to my shirt, and you can see it's a little scary looking. It's not the end of the world. It's a little scary looking, okay? Now, if I show you what I tend to inject with, it varies. I can use 27s, which are even smaller, and I can use 30s, which are even smaller. So I'll show you just very quick a 30, what that looks like next to this 25. I'll take this off, I'll put on a 30. You just basically push down and you just twist it a little bit and now it's locked on. I just put my fingernail right there, and then with my other finger, I just pull off the plastic cover. So you can see the difference of that needle compared to the other needle I had up. This is much, much, much smaller. So if I look it up next to my hand, okay, it's pretty tiny, right? It's pretty tiny. The thing is that when you're injecting testosterone, it's an oil, and the finer the needle, the tougher it is for that oil to pass through. So between if I take a 25 or I take the 30 is smaller, which means that I really got to push hard on that plunger to push the oil through the needle versus with the 25, that goes through like nothing. And then you can have a 27, which is somewhere in between. Obviously, the bigger the needle, the more discomfort you'll feel. The smaller the needle, the less discomfort you'll feel. So then you have to weigh the options. Do I want less discomfort? You know, I don't like pain too much, and I'm willing to put a lot of pressure and really take my time to inject, or can I deal with a little prick? It's not the end of the world, and it's a lot easier to inject. It takes a lot less time. The very first site that I had found, which was supposedly the least painful site to do, and at this point I was only looking at intramuscular injection, also known as IM, was what's called the ventrogluteal muscle. So the ventrogluteal muscle it's the muscle right here on the side of your leg. If you put your hand here and then you lift your leg up, you're going to feel this muscle flex. As soon as you start lifting your leg, you're going to feel that muscle kind of bulge out, and that's called the ventrogluteal muscle. And that muscle has very few nerves, and it was known as being one of the least painful places to do intramuscular injection. So when I started this whole injection route, I was doing weekly shots because, again, I was scared to death of needle. I would lie down on the couch, and my wife would basically jab this into that muscle right there. And as little as it hurt, I was, the biggest baby, and I was lying on the couch just writhing in discomfort, and my head was spinning, and I felt like I was going to pass out. But with every passing week, it got a little bit easier, and I started kind of getting used to it. I could not watch her do it, but as long as I looked away and she did it, I was fine. So then it got to the point that she was fed up of doing these injections, and she says, "You're going to have to do them yourself. Man up and do them yourself." Now, considering we're taking testosterone, we're trying to be men here, okay? You got to man up and say, "Hey, I'm not going to be afraid of this tiny little thing." If you're on test and you're afraid of this tiny little thing, I mean, you gotta get over it, okay? If you want to compare getting punched in the face or you're getting stuck with this tiny little thing, I'm sure you know where I'm going with this. So I then started looking into what's called SubQ or subcutaneous injections. So subcutaneous injections or SubQ is where you are injecting into the fat. So there's pros and cons, actually mostly pros when it comes to that. There's very little difference in how much testosterone is absorbed doing intramuscular or doing subcutaneous. So either method of administration, you don't really have to worry about one jacking up your test more than the other. It's going to be very, very similar. When you're doing intramuscular injection, you're going into the muscle. You need to have needles that are a little longer to get through the skin, through the fat, and into the muscle. Once you're going into the muscle, you're basically breaking through muscle fibers. And some guys, they say, I injected my delt every day type thing. You got to think of that needle going through those muscle fibers. It can eventually cause a little bit of scar tissue. When you're doing it in the fat, like in the belly fat, you're not breaking anything. Yes, you're poking a little hole through the skin, but that little hole is going to heal up literally within minutes, and it's gone. So you can, jab yourself 10 times a day, and it's really not going to make a difference compared to intramuscular. With intramuscular, the testosterone can sometimes absorb quicker than SubQ, so you tend to get a little bit more of a spike and a little bit more of a drop off. With SubQ, when you're going into the fat, and you got to keep in mind that in the fat there are blood vessels. There's blood flow going through your fat. So whatever you put in the fat will eventually get into your bloodstream. It gets released a little bit slower, so you have a little bit more of a steady release. Maybe a sustained release, if you will. Some guys tend to do way better with SubQ, and others tend to do better with injections. I've heard people that do SubQ and they say, "Oh, I don't feel it the way I feel with injections." Yeah, when you get an with intramuscular, when you do it with intramuscular, some guys say they feel it fast. I don't necessarily want to feel it fast. I want a nice steady flow throughout the day. And there's other guys that when they're injecting in the fat, they get these little nodules. Other guys don't feel well, and sometimes it's just the type of oil that is being used. So if I look at my little vial here, this is what we get in Canada. It's called deletestrol. It's 200 milligram per ml. And it says here, it's in a base of sesame oil. Okay, so you can have sesame oil, you can have cottonseed oil, there's all types of different types of oil. For guys that are doing it and getting a reaction, or they don't feel well, or they get these bumps, or they get rashes, or whatever it is, it could be a sensitivity to the type of oil being used. So you can just simply ask your doctor to prescribe you a different type of oil, which you might be less sensitive to. SubQ, discomfort-wise, I find it much easier as a guy that went from being scared to death of needles. I find it much easier to inject myself SubQ than going into IM. I've been injecting myself now every day for, it's going on years. And there was a guy in a group that said, let's do a test and we're going to do intramuscular. And I tried to do it in my shoulder and it freaked me out. I couldn't do it. I don't know, just scared for whatever reason. So SubQ is a really great way to start. You want to do as frequent injections as possible. When you're doing the one time a week injections, which your doctor will usually tell you to do, which is just, it's not recommended. Some of your doctors might even say to do it once every 2 weeks or once every 3 weeks. I met one retard once that told me once every 4 weeks. You got to keep in mind when you're giving your injection, you're getting a spike of testosterone, and then over time it starts going down, going down, going down, going down. I can get into half-lives and stuff like that, but I want to try to keep this video a little bit more simple. The body produces testosterone every day. The body does not produce a whole bunch of testosterone on a Monday and then nothing over the course of the week until you run out and then gives you another boost. It's just constantly giving some. We have found that giving yourself a more frequent injection, so once a day in a tiny little amount, the body seems to do well with that. It's a nice small amount. It doesn't make your body freak out. It doesn't send all your other hormones out of whack. You know, and it keeps things kind of smooth and steady. So you always have kind of the same amount every day. All the other hormones in your system will kind of balance out themselves to match that level of testosterone you have, and that's it. Versus the one big spike at the beginning of the week, all the other hormones adjust, and then as your testosterone is dropping over the course of the week, all these other hormones have to keep adjusting to these new levels. And guys typically don't feel as well as they do when they're taking multiple times a week. So I can show you what's involved in doing an injection if you'd like. I've done mine this morning, but I mean, I don't think it's gonna kill me if I take a little more, right? So a lot of people are saying, you know, this thing takes it's a lot of time, and you got to put aside a lot of time to do this. Once you've got used to doing this, it's literally 60 seconds out of your day. Like, it's really, really, really quick. Obviously, if you have everything in one drawer in your bathroom or one little spot where you can just take it all out and just get it done, that helps. You know, I used to have my test in one spot, my syringes in a different drawer, and then the alcohol in the other bathroom, and I was walking, you know, just have everything in one spot. So basically all I do is I have these, like I said, this is my syringe. It comes with a needle, which was this guy right here, okay? This blue one, I basically have no use for it. I take it off. I do not use the same needle to draw the oil out as I do to inject, all right? I use a different needle to draw. The needles I use to draw, I tend to use 18 gauge. These are big, scary needles. I'll show you what these look like, and don't worry because they won't be coming anywhere near you, so there's really nothing to worry about. So I'm just gonna take this off really quick. They come in this little wrapper. You just open this up, pull it out. So just like before, I'll just take this guy off, put this guy on, push down, twist, and now it's on. Put my fingernail in the little tab gently. And you really want to pay attention when you're taking off this plastic, because at the beginning I have kind of like took it up too fast and stabbed myself with the needle, and that's not very pleasant. So if you look at this guy, so this is the stuff of nightmares. Okay, I don't want to have to stick myself with that. But these are great to get the oil out of the vial into the syringe in very little time. All right, which is why I tend to use these. So this is what my vial looks like. Okay, it's a little pressurized vial. It's got a little rubber tip to it. Okay, I'm just quickly gonna cover this up just temporarily because it's always good to put a little bit of alcohol on the rubber where you're gonna be injecting to make sure that it's sterile. Do I do this every single time? I don't. I'm not saying you shouldn't, because I can be a bit of a retard sometimes, as many of you know. But you should. Ideally, you should. I'm also out of those little professional cotton pads, so I'm just going to use some toilet paper just for the sake of the demonstration. All right. Again, a little dab. Right. Just clean off the top, so it's nice and clean. That's all there is to it. All right. So I'm going to just close this up so I don't knock it over. Okay. So I'm going to take this guy off. I'm going to pull out just a touch, for the sake of example, because I already did my injection this morning. So let's say I'll pull out, I don't know, 0.1 ml, just for the sake of example. There are guys that measure this kind of incorrectly, and I'm going to explain to you what it is. So here's what we're going to do. In this vial, there is oil and there is air, and it's a pressurized vial. I want to pull oil out of the vial, which means I got to replace with air in the vial to keep the pressure the same. So from my syringe, I will go down to 0.1 ml, or even a little bit more, it doesn't really matter, okay? I'm then going to push my needle through the rubber, and then I will press down on the plunger to fill the vial with air. So now there's a little bit more pressure in there. I can now flip this guy upside down, pull my needle back to ensure that the tip of the needle is in the oil. I don't know if you can see it there. And I'm going to pull back on my syringe and withdraw the amount that I need. Typically what I'll do is I'll pull out a little bit extra and then I kind of push it back in, okay? I'm just gonna pull this out like this, and I'm gonna just demonstrate something that a lot of you guys get wrong and that I got wrong for the longest time. So you can see here that my plunger stops at 0.1 ml. So you would say, okay, well, that's how much you're gonna be injecting. Well, not so fast. There's 0.1 ml in the syringe, but there's also oil up into this thing and in the needle, okay? So if I was to get all this oil into me, I'd be giving myself more than 0.1 ml, and I'll demonstrate. If I draw back on the plunger, okay, and I'll put my plunger, let's say where it says 5, if I give it a little bit of time, you're gonna see that I actually have about 1.5 or 0.15 ml of oil. Why? Because the amount that I had, there was an additional 0.05 ml in this syringe, okay? So if I really, really had wanted to inject myself with 0.1 ml, I would have withdrawn only like 0.5 because to the line of 0.5, knowing that there's another 0.5 in this whole thing. And if I would pull back on the plunger, I would see I have 1. For the sake of example, I'm just gonna keep things like this. I'm hoping I'm making myself fairly clear. So I pull all this back, and then I cover up this nasty, nightmarish needle. All right. And then what I'll do is I can put on one of my, I'll use my 27s here. Just give me a sec. So the 27s is in between that 25 I showed you at the beginning and the 30s, which are really slow. I find this is kind of a good middle ground for me when I'm in a hurry. All right. So I'm just gonna pull this guy off, and I'm gonna put this guy on, and I'm ready to go with this, okay? For guys that have never injected before, it is a very, 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 very odd experience to purposely stab yourself somewhere. The first time I tried to do it, I had the needle literally, right next to me, lying down on a bed because I was positive I was going to pass out, about a half an inch away from my skin. And I think I sat there for about 3.5 hours. And I finally managed to do it. And I didn't pass out. I was actually very proud of myself. So what are the things to keep in mind when you're injecting? Okay, so again, when you're choosing your injection site, I'm going to put this down for a sec. Okay, you can basically do, some people do the love handles, but I find it hard to get to the love handles. I tend to do literally anything around here, anything over here, anything over here. And yes, I got a little chubby since I stopped training, but the testosterone's been keeping me relatively lean anywhere. Anyway, so basically any of the softer area on either side is great, okay? You'll pick a spot. Again, ideally you want a little oil, alcohol, swab that area. You don't want to swab the area and inject right away. Why? Because the alcohol is on your skin, and when you inject right away, that alcohol will go into the tiny little hole and you'll feel it burn. So apply the alcohol, just clean off the whole area, and give it a couple seconds for the alcohol to kind of evaporate and dissipate. The other thing I notice when I'm injecting is sometimes I get a needle that it's almost like it doesn't want to go through. It's like I don't know if it was a defective needle or it's a dull needle, and I'm literally like pushing in the skin and it's not going through. If ever you get a situation like that and you're not sure, just take the damn thing off, get a fresh one, put it on, and you're usually good to go. Other interesting thing, I'll find that, and I'm just going to do this demonstration with this plastic on, okay? I don't have the needle. I found that there's times that I'll be touching myself with the needle and I'm like, ooh, like it's almost like more painful than usual, just touching the tip on the skin. And you got to keep in mind that there's nerves. Sometimes just moving it to a different side, like even an inch away, and you press and there's no sensation whatsoever. And then you just push through like butter and you literally haven't felt anything, like not even pressure. It just goes through like really, really, really simple. So I'll just, I'll show you what I'm doing here. If I wanted to inject precisely the amount of oil that I have in there and not waste any of the needle, very, very simple. You turn the needle upside down. Here, wait. Usually what I'll do is this. Just get a little closer to the camera. And I have done this in another video, but in case you haven't seen it, because I'm not that particularly interesting, I'll tend to leave about a 0.1 ml of air at the top of my syringe right here. So here's my plunger, here's my oil, here's air. Once I have my 0.1 ml, I'll turn this guy upside down and I'll let the air get in between the plunger and the oil. Okay, so now I have my needle, I have oil, I have air, and I have the plunger. Why? I'm gonna use that 0.1 ml of air so that the plunger pushes out the air and pushes all of the oil into me, and this way you're not even wasting a drop. Okay, this is a fantastic way to not waste. When you're doing injections every single day, if you're going to waste 0.05 ml every single day, it adds up to quite a bit of waste, all right? So what do I do? First thing I do is I'll take this off here. Okay, so here's my 27, which again, it's a little bigger than the 30, not much bigger. It doesn't really cause that much of a difference, but it's a hell of a lot easier to get the oil through this guy than through a 30. Okay, if you really want to be scared of needles, use a 30. It's even smaller than that, but you're going to be pressing for quite some time. All right. So again, I'll have my oil in between.
Danny, I heard that the slower you inject, the less painful it is, the oil coming into your skin. Is that right?
When you're using needles of this tiny, like 30s in particular, you can't just press down the plunger like all at once. It's just not going to happen. It's going to go really, really, really slow. So it's hard really to rush through it. You know, maybe if you were injecting yourself with these big 18s that I was showing you, and you just press on the plunger all at once, perhaps that you're going to get some discomfort. But considering the size of the needles, I haven't been able to experience that because it just takes forever to do oil.
It's slow anyway. Okay.
Right. I'm sitting outside because the baby's sleeping. and it's hot. Okay, so just gonna pull this up over here. All right. And yes, I should have put alcohol, but again, I don't always do it, and frankly, I've never had a problem. But don't do it the way I do it. Just put alcohol anyway. All right. So again, there's guys that will just kind of jab themselves all at once. I haven't. All I do is I just put the needle up against my skin, okay, and just push it through. Now that time there, I literally felt nothing. There was no discomfort whatsoever of any kind. So I'm going to keep this guy stabilized with one hand, and then using my other hand, I will push on the plunger, okay? So I'm going to hold the base so my needle isn't moving around too much, and use my other hand to inject. So my thumb and my third finger on the little plastic things, and my index finger on the plunger, and I just give it some pressure. And again, it takes some time. I wait for everything to go through. And once everything has gone through, just pull it out like that. Now, one thing I do as soon as I pulled it out is I'll take my hand and I press on the injection site. And why? I find that a lot of people have told me the same thing. When you're pressing on the injection site, you're actually making the oil like push and disperse a little bit more through the fat. So I'll literally just press on it and just kind of massage it in instead of it staying all in one spot. And that's it. Like that was no pain, no discomfort, no nothing. I even used a 27 and not a 30. And you're done. So, put the cover back on. You're finished. I take my 3 needles, I put it in I have a little bin where I put my used needles. I bring them to the pharmacy once every couple of months when it gets full. And that's the end of that. It's really no big deal. You want to use a different, I'll alternate sites. I don't always go in the same spot. Sometimes it's this side, sometimes it's this side, sometimes it's like literally an inch from the belly button, or maybe a little higher, a little lower, and just kind of rotate. Some people do get like these little bumps, these little nodules. You typically get that when you're injecting a lot more oil all at once. With this tiny amount that I had, there's no way I'll get a nodule with that. If you're going to do SubQ once a week, yeah, you might wind up with a little bump. Don't panic. It'll get a little red. It'll get a little swollen, even a little itchy. If you touch, it's kind of like painful. And you give it a couple of days, it goes away. It's not the end of the world. Nothing to worry about whatsoever. That's pretty much all I can think of.
One of the extra questions in that question was, how often do you recommend injecting a week?
The best you can do is every day. Again, you can do once a week. So let's say for example, you were injecting yourself with 200 milligrams a week. So what's 200 milligrams? Well, my oil is 200 milligrams per ml. This syringe is in 1 ml. Now, if I was going to be injecting myself once a week, I'd be basically filling up this entire syringe with oil and giving myself one big injection. That's a lot of oil I find for one big injection. You're not going to keep that stable level throughout the week. When I had moved twice a week, I said, well, I'll do half a syringe on Mondays and half a syringe on Thursdays or whatever. That was better. And then I started doing every other day, so every second day. That felt even better. And eventually I said, well, hell with it. I'm just going to split up my dose at 7. And every morning, take my shower, do my thing, a little injection, and you're done. And that's given me the best results. One little, take your dose, split it by 7, figure out, well, how far down with the plunger do I have to go so that when I inject, I'm giving myself precisely the amount I want to inject, and that's all there is to it. That would be the best method that you can possibly use for injections. And again, if you're finding yourself that you're often having issues, maybe ask your doctor for a different oil. You might have to do intramuscular if it's just not working out for you with SubQ. But for injections, you can't beat daily. You can't beat doing it twice a day. Is now you're just kind of getting silly, but once a day is fine. Once a day is perfect.
Okay, thank you so much.